Good morning, everyone. Welcome to our 7th Science Café. Today, we will have the opportunity to establish the context about the SIRENE project by Miriam Cabrita from Science to Europe. And we will have the opportunity to listen to our inspiring expert, Marta Fernandez from RMIT. She is a chartered chemical engineer and has a PhD in carbon sequestration. She is the executive director of RMIT Europe and has a strong interest in urban well-being and has been expert panels in nature-based solutions in cities, energy efficiency, and active aging and the built environment. She is representing RMIT and the European Construction Technology Platform and the European Universities Association. She will explain us about how the design for health promoting environments is also related to safe environments. And then we will have, if we have time, we will ask her some questions about her presentation. So let's go back again. As you know, SIRENE project wants to support the growth of social innovation actors in the promotion of safe environments. When we talk about what is social innovation, there are some descriptions. We normally like this one of our experts in the first Science Cafe. That is in social innovation is new or novel ways that society has to deal with relevant social challenges that are more effective, efficient, and sustainable, or that generate greater impact than the previous one, and that contribute to making it stronger and more articulated. And when we talk about safe environments, that is smart, healthy, age-friendly environments, we take it from the SAFE Stakeholders Network, and it establishes that to live and participate in society, it is necessary that working and living environments are functional, usable, accessible, affordable, protective, and reachable. With ongoing digitalization of society, a lot of new opportunities arise, and digital solutions can assist citizens to live and promote a healthier life, be independent, participate in society, have opportunity to work into later life, and ensure better living conditions, increasing well-being. But we have to always take into account that digital is just a tool. We need the whole ecosystem to work together to make this work. So as you know, this is the 7th Science Cafe of a series of 8. The first ones were held last year in 2023. From the general concept of what is social innovation and how social innovation can be applied to safe environments. Then we had another Science Cafe focused on the different challenges that from different stakeholders groups face when they want to implement safe environments, from the public administration, from research and academia, from the private sector, and also from the society, from older citizens mainly. And now we are going to the last one, when we're going to have like a more general approach and to see also how this is not just related to aging, it's related to lots of things. And as Marta is going to explain us, it's also related to health. So we have today 3 different, well, I'm the speaker, I am like the moderator. We have 2 different speakers. We have Miriam Cabritas from Science to Europe. She is representing the coordination of the SIRENE project, and then we will have Marta. So when you want, Miriam, you can jump in.
Thank you very much, Sylvia, for the introduction, and hi to everyone. Yeah, we can move to the next slide. So as presented by Sylvia, this is the context of the SIRENE project, and this ambition to create or to promote smart, healthy, age-friendly environments. SHAFE needs the collaboration between many different sectors. So, for example, we have here the sustainable built environments. We need to create inclusive and accessible communities. We need the cooperation from the IT, from ICT for the digital technologies, and of course, health and social care. And our aim, and we can move to the next slide from the SIRENE project, was to promote social innovation to reach these communities that are inclusive, green, smart environments. So SIRENE is a coordination and support action. It's actually close to the end. We are in the one before last month. The project will finish in the 31st of October. It's a collaboration between six partners, and it builds on 3 pillars: so the social innovation, co-creation, and sustainability. And how do we do that? We go to the next slide, please. One of our core, let's say, outcomes is the social innovation framework. That is it's composed by 5 different components. We have a blueprint of good practices, a capacity building framework, sustainability strategy, hands-on toolkit for networking, and a manual on social innovation. So what we want is to provide the knowledge, the tools to support social innovators. Then we also have a repository with many projects, initiatives relevant to the field, where we can see what is happening, not only in Europe but also outside. And of course, we can only do that, and that's the core of this project, with collaboration of experts, as our speaker today, through the SIRENE Digital and Expert Hub. So we have these 3, let's say, ambitions. We want to inform, and we do that through these type of activities. For example, today we have a science cafe. We have many material in our website that we invite you to look at. Building capacity and connecting. And about the connecting, if we go to the next slide, please. Yes, exactly. So we are very happy to, within these 2 years, we brought together 57 experts from the U27 and beyond. Many activities, many collaborations that started, and if you are interested, you can join. And then we go to the next slide. It's exactly what you can do if you are interested in the topic. One is, of course, to contact us to become part of the Experts Hub. We can contribute if you know about, as I said, materials, projects, initiatives in your region or beyond that are relevant for the repository. Please send it to us, and participate in the activities. And we just going to the next slide, please. We are now preparing this final event from the 1st to the 3rd of October 2024 in Brussels, where we will bring the experts together, and we will have opportunities to discuss and to, let's say, to foster these collaborations. So this was a very brief. I wanted to be very brief with the presentation of the project, because we want to leave the floor, of course, to our experts. That's the most important of the day. Thank you very much.
Thank you very much, Miriam. And now we will leave the floor to Marta. Marta, if you want to share your screen.
Yeah. Thank you very much. Thank you for the introduction. Great to be invited, and it's a real pleasure to be part of the SIRENE community, and have been engaging with you for the last few months on the delivery of this fantastic project. So thank you, Sylvia, for the introduction about my background. So I won't say much about that, just add that I was working before I joined RMIT for 8 years in the built environment sector, and I had a keen interest in healthy environments and aging, and I thought I would share with you from a personal point of view how I started having an interest in this area. And I was 13 when I started volunteering, looking after elderly people in care homes, adopting grandmothers when I was living in London, and did that, for many years until my children got all my spare time blocked. So when I was at the time working at Arup, which is a design and engineering consulting company, I thought, what can I do from my day job that can contribute beyond the individuals that I'm actually supporting? And I thought that I could not only engage with individuals, but also in my role as a head of research, I could use that to raise awareness, influence policy, and also drive research and innovation that could benefit many, not just a few. So I engaged in the UK with the UK government on an initiative called the Long-Term Care Revolution. I was also an expert with the European Commission on developing a roadmap for nature-based solutions and how they could drive urban regeneration. And as I joined the chairing at the time of the Committee of Active Aging and Design at the European Construction Technology Platform, where I work closely with Sylvia, I realized that we needed to extend the focus from aging, because aging is a lifelong process, and focus on the health promotion should be the same way in which we focus about nature positive environments. We just need to think about people positive environments. So how can we have spaces, cities, places, offices that are actually people positive, both from a physical health, but also a mental health side, and considering equity and diversity so that we can move to more sustainable spaces altogether. So this is how I think it's important to think about health and well-being, in the context of aging and spaces for the aging. So because in the end, it's something that benefits the whole population. So I thought that if I move to the next slide, I wanted to share with you what do I mean by more sustainable spaces. And we have to consider how buildings and other systems can actually be regenerative and be producing this positive impact for human and natural systems. And in that context, it was good to consider how could human activities for a change improve the environment and enhance well-being. And this is when we start talking about the concept of regeneration, where we are moving beyond sustainability, not only to not, leave the place the way we found it, but actually be regenerative and leave the place before much better than we found it, improved health outcomes, improved environmental outcomes, nature positive spaces. So we have now at RMIT Europe, we have a strong focus on regeneration and developing regenerative futures so that we can actually consider how we could be transforming the way we live, the way we work, the way we build, the way we power our lives, so that we are promoting health and nature. And in this opportunity of rethinking our spaces, rethinking the impact that we can make, is critical to consider the relationships that buildings, communities have with health. And this is a concept that is not new. Already, back with the cholera pandemic many years ago, combined with technological and scientific advancement, it was a critical time to make a visible connection between the design of environments and health. And back in the day, there was all the learnings had an impact on city planning, on building codes, and there was major progress in public health and sanitation. But what's happened since then is that chronic diseases are having a less successful in terms of being a driver for change in our built environment. And perhaps back in 2020 with COVID, there was this sense of renewed urgency and interest in the role that the buildings and our spaces play in health. And for example, if we have poorly ventilated spaces, there is a link to that to increased absenteeism in offices. And that in turn has an impact on the operational costs for businesses, impact on drop of productivity. And there are figures in the US where 35% of total absenteeism in the country is due to the insufficient provision of fresh air in buildings. And this picture is a picture of Hong Kong, where there are more than 40,000 buildings that are classified as energy efficient buildings. And about 50% of them have been labeled with the label of sick buildings. So these are buildings that expose occupants to discomfort and health issues due to, bad indoor temperature, poor ventilation, and so on. So maybe just to share another one linked to the aging, RMIT completed a study recently looking into air quality issues in aged care facilities. And what we found is that in some of the common areas, the concentration of CO2 was 3 times above the maximum recommended CO2 concentration. And we've done similar studies as well in school, where we've been linking that poor quality with a drop in cognitive performance for students due to this poor ventilation. So there is a massive, as you know, as you've seen, there is a massive impact between our spaces and health. We've established that. So the question I was going to ask, and if we were doing a live session, I would look for a show of virtual hands or what have you, but I'm just going to have to show you the slide with the question of how much of this built environment, how much impact does it have in our health, and how does it compare to factors like, you know, our lifestyle choices, genetics, or the access to healthcare system. And I was very surprised when I first saw this slide, because it's actually, as you see, more than 50% is what it takes from our physical and social environment. Is more than 50% in terms of impact on our health, and you know, very little there on our genes. 25% lifestyle choices, you know, exercise, food, and so on. So it's absolutely massive. And when you think about this in the context that humans spend more than 90% of our time indoors, really, our state of health starts with all the spaces that we inhabit every day. It's home, it's work, is the city, the public spaces as well, where we interact with each other. And all of these should be designed to create an ongoing positive human experience, because they are a major determinant of our health outcomes. So I'll share with you, and this slide is from the International Wellbeing Institute, which is an organization I've been collaborating for the last few years. And they've been driving a movement on healthy buildings and have developed a global standard, the Wellbeing Standard for healthy buildings, which is helping to promote the transformation of our buildings and communities to help people thrive. And this standard considers not only, you know, the definition of health by the World Health Organization, which is not only the absence of disease, but it's a complete state of physical, mental, and social well-being. And I was working with them to develop the research agenda for the standard. So just to point that it's really evidence-based. It's an evidence-based standard. So you can see there on the slide the factors that it takes into consideration: quality of air quality, the access to water, access to quality food and healthy foods, good lighting, being able to have spaces that promote physical exercise, comfort, and then also takes into consideration mental health. And I thought I'm not going to go through each of them in detail, but I'll touch on some of them as examples so that you can see. Oops, I think it jumped one. No? Okay. Just on air, I don't have a slide for that one. Perhaps when we talk about air quality, we immediately think about, particularly with COVID, on the transmission of infectious diseases and so on. But actually, air pollution is a major issue, and air pollution is outside in the city is directly connected to the air quality that you're going to have in your house. And there was a Lancet review study that shows that the 10th most significant cause of ill health for the world population is air quality. So interventions that have an impact in indoor spaces, like ventilation and operable windows, filtration systems, methods to manage construction pollution, systems that can do predictive maintenance and operations for buildings, are all measures that can be considered to improve the air quality of the spaces that we occupy. Another factor to flag is lighting, and lighting is not only important to to be able to see things more clearly, obviously, but it's also important to increase alertness and to enhance the experience of spaces and to promote sleep. And if you have the wrong lighting, that can have an impact on the body's circadian rhythm, and that is linked to issues like obesity, diabetes, depression, and metabolic disorders. So, and there are controls that can be put in place to improve quality of lighting. Occupant controls, one could design lighting as well to promote the circadian rhythms, have good access to daylighting and the light quality. And I thought I would share with you this picture because lighting is also important for inclusion and the consideration of the needs of the different segments of the population, as well as the increasing proportion of older adults. So this is how the environment would be perceived by someone with cataracts. And it's about 80% of the population above 80 that has some form of cataracts to more or lesser extent. So designing lighting that promotes a better experience of the built environment, so older people can feel safer and more comfortable, is important. Sorry. So I'll move to the next slide. I was referring before as well to physical exercise. This is a picture of my team. We have a little running club in the office. They would probably be mortified to know that I'm sharing their pictures here, but we're very proud of our little running club. So in terms of movement, we have there was research from around 150 countries that make 93% of the world population, that shows that a quarter of the adult population of adults are physically inactive. A quarter of the adult population are physically inactive, which this means that there is about 1 million deaths per year that could be avoided if physical inactivity was reduced by 25%. Simply reducing by 25%, we could save 1 million lives per year. So how can we think about the built environment and the way we design it so that we can promote movement? We can promote, maybe we can have more active furnishing, or we can promote ways in which people can move around spaces. So doing site planning, the way we select where buildings are put, how can we promote spaces in the city that, foster active mobility, and considering the needs of the aging population as well, so people feel safe to go out and move about in the city. So this is another important factor, and I'm sure many of you arrive in an office block and you can't find the stairs. It's by default, go to the lift. So that's an area where design can make an impact. And maybe the last one I'll just mention is mental health, because it's not only about the physical health. And there are about 30% of adults in total in the world that will experience some sort of a mental health condition during their lifetime. And depression is considered by the World Health Organization as the largest contributor to global disability. So if we could have spaces that are supporting cognitive and emotional health through design and technology and mechanisms and strategies such as access to nature, sleep support, these are all measures that can reduce absenteeism and can enhance also the overall perceived health. So if I move to the next slide, I wanted to share with you, and this is very focused example in office spaces, but One of the things I wanted to flag is that technology obviously has a role to play in all of this. It's not just the design. Technology can be very useful if we want to be able to, for a start, make an assessment and be able to track and monitor and adjust building performance levels and have, you know, sensors and actuators around our spaces. And we did a research project with Arup and their Melbourne office, where we were looking into ways in which we could measure staff comfort and concentration in flexible spaces, and how we could connect that to patterns of human behavior. So we also worked with psychologists to identify variables that could measure concentration and levels of comfort. And we collected physical data of air quality and noise and indoor temperature air quality and so on, including, you know, monitoring electromagnetic fields and all. And we combined this sensor data with the survey and used machine learning algorithms to identify patterns of perceived concentration and activity. And through this work, we've done some set of suggestions for how to make, you know, open plan offices and hot desking, you know, spaces work best for people. So not so much about the home, it's more about the office, but one could look to you know, transfer some of the knowledge into that. Particularly if we think about spaces like care homes that in the end are combining a workspace with a living space. And if I move to the next slide, just to show you that this is not just about buildings, it's also how we consider the city and how we need to consider those spaces between buildings, and that allow individuals to access and participate and thrive in society and in communities, and that, you know, these are also important factors that are shaping individual and collective health outcomes. And there are studies that actually link individual health, well-being, and performance with community and larger scale influence, particularly around equity and sustainability and community level empowerment. So this slide shows some analysis that we've done at RMIT. There is a group called the Australian Urban Observatory, and we've created a web platform that is translating urban data into livability maps that are overlaid with GIS maps. And I don't have any in this slide to keep it short, but happy to share with anyone that is interested. So we could link the impact that all of those factors that you see on the slide have with health, and then map that into the cities. So we did this with 11 Australian cities, but then also extended it to 25 cities around the world, including in Spain, Barcelona. So we could see by postcode the level of health promotion that part of the city had. So very happy to share that with anyone interested, because we're looking to turn this into an international urban observatory and have set ourselves the challenge of 1,000 healthy cities. And we have a lot of people interested from around the world to see how to apply this methodology into their city, which is fantastic because in some cases we're already seeing how it drives policy. We've had cities developing their own healthy city roadmap for the next 10 years based on the findings of applying this mapping. So that's what I wanted to share with you about cities, and maybe just some final takeaway messages. And I like this slide because sometimes, you know, when we talk about smart and healthy environments and so on, there is sometimes a default thinking that technology is going to give us the answer, and all these sensors and ambient assisted living is going to resolve it. But actually, we need to make sure that we ask the right question to the technology. We ask ourselves the right questions so that we can address the challenge at hand. And the other point is that we need to take into in all of this a long-term view. Anything that gets built is going to be there for the next 30 to 50 years. So if we're bringing together governments and private sector investors, we need to be provoking them so that they are proactive and they have a long-term view, so that any building that gets delivered has this inclusive, human-centric approach that has at the core the health and wellness practices. And the last point I'll say is that there is a need to have the leadership and the investment from industry, the research and innovation from academia, and also the complementary policy and regulation from government, as well as that civic engagement, those elements that form the quadruple helix for innovation. And they will be fundamental if we want to make a change in the built environment so that we can have more inclusive and healthy spaces. So no place for business as usual. From me, we need more than ever a strong vision for a regenerative, inclusive, and health promoting environment. So thank you very much for your time.
Thank you very much, Marta. Very inspiring as always. Well, we see the World Health Organization, when was describing healthy aging, already said that there were these intrinsic things that people has, like your health issues, but also the influence of the environment. So it was quite inspiring to see that graphic with the more than 50% of the percentage of environment in our health. And also that I agree with you, that we start getting old at 20 years old. So we must start thinking on health very soon. It's not an aging issue. Aging is not a problem, it's natural. But health could be a problem if we don't take measures. So thank you very much. I don't know if Miriam, you want to ask something to Marta? No?
Thank you. It was very, very interesting, very inspiring. Thank you very much.
I need that we need more than science cafes for these sessions, like, I don't know, because half an hour or 40 minutes is very short. So thank you very much, Marta. See you soon. Thank you, Miriam. Thank you for the organization books. And well, see you in the next and last one. Bye-bye.
See you.
Bye-bye.
Thanks.
Thank
Bye.
you.